we have your crisis intervention. I think narinig nyo na rin tong crisis intervention. But the crisis intervention, this is the one being utilized for during emergency or during crisis situations. Okay, so like for example, ginagamit ito sa mga victims ng typhoon, victims ng mga major traumatic experiences. Okay, so usually ginagawa natin dito is we do debriefing. Okay, we debrief. Okay, debriefing of the patients based sa nangyari sa kanila during the past few months. Okay, to intervene inside the crisis. Okay, so it is a systematic approach to short-term therapy since crisis is acute, okay? Acute condition or acute event yung kanya dinidil, hindi yung chronic. Pag chronic, like yung mga traumatic disorders, iba na po yung ating intervention. Hindi na po kaya ni crisis intervention. So what happens here, the mechanism is that the nurse works with a client, family, or group that's experiencing a potentially dangerous situation or a dangerous situation that happened to them. Okay? And the purpose here is to initiate actions to decrease the client's sense of personal danger. So what we do here is number one, we resurface what happened to the patients or to the group. Okay. Then we identify what are the actions that we can do in order to decrease the effects of this crisis to the group or to that person. Okay. And this is also to facilitate the client's ability to control the situation. What are the things that the patient can control in the meantime during the crisis? Okay.